In this module, we are to learn the different types of nursing research and the level of evidences. Research can be classified into many things. First, it could be according to the level of investigation. Research could be exploratory, descriptive, or experimental in type. Exploratory research is defined as the research used to investigate a problem which is not clearly defined. It is conducted to have a better understanding of the existing problem, but will not provide conclusive result. Meaning that you just have to explore what could be happening in a specific phenomena. The preliminary research is to clarify the exact nature of the problem to be resolved. When we do say descriptive method or descriptive type of research, it is a study of particular situation or event that already exists. Purpose is to be observed, described, and document as if aspects of a situation or its naturally occur. And of course, experimental research is the study that strictly adheres to a scientific research design. It includes a hypothesis and a variable that can be manipulated or tested by the researcher. Variables can be measured, calculated, and compared. And most importantly, experimental research is completed in a controlled environment. It could also be classified according to the approach or the nature of design. Sometimes you can do it in an experimental environment or non-experimental. We have explained already what experimental type of research is, wherein you control the environment of the research. Secondly, non-experimental is when the research is labeled given to a study where a researcher cannot control, manipulate, or even alter the predictor variable or subjects, but instead relies on interpretation, observation, or interactions to come to a specific conclusion. Another one is that research can be classified according to the measure and data analysis. So, meaning we could be talking about numbers or measurement. Okay, so it could be classified as a quantitative research or a qualitative research. We all know that a quantitative research talks about numbers such as measurement of the blood pressure, temperature of the patient, while qualitative data talks about the not measurement of by numbers, rather by collating the most number of responses. Okay, so we are talking about words. For example, how many individuals said they had a painful experience giving birth. Okay, this is a type of qualitative data. Research can also be classified according to objective or the intent. It could be basic or applied research. When you say basic research, it is primarily done to explore basic information for the sake of knowledge, for the sake of knowing. And when we say applied research, it is conducted to obtain knowledge that can be applied in a practical manner and contribute to a modification or practice to solve existing problems. So basic is more of understanding, just as same with the descriptive type of research. Applied is when you do applications, such as those what you do in evidence-based nursing practice. Research can also be classified according to time frame. So it could be longitudinal or cross-sectional type of research. When we do say longitudinal, it is performed over long period of time, and participants are being followed up over a time prescribed intervals. So, for example, you would like to see who among the 1,000 smokers have developed lung cancer after a 10-year follow-up. So that could be an example of a longitudinal study. While cross-sectional study means that the collection of data at only one point in time. So for example, with the patients who are in the COVID facility, who among the patients admitted in the COVID facility is having or had cough, fever, and loss of taste, for example. There could be no follow-up, or there is no follow-up in doing cross-sectional type of research. Comprehensive picture of the patient or of the respondents is the one that is explaining the existing phenomenon. Research can also be classified according to the timeline. Okay, it could be retrospective and prospective type of research. When we do say retrospective, it uses data of the events that have already been collected in the past. For example, you would like to know in a healthcare facility how many patients were admitted due to the admitting diagnosis of dengue fever. Okay? In doing prospective research naman is that when you do start with a presumed cause, then you go forward in time to the presumed effect, similar with experimental studies. However, you are prospecting, meaning looking forward. For example, at this point, to those patients who were diagnosed with COVID-19, you would like to see who among them will later on be more prone of having pneumonia or um, pneumonia that are being complex or complicated. So that could be a type of prospective research. And lastly is that research can be classified according to the research environment. It could be a field research or a laboratory research. When we do say field research, it may be performed or done in a specific area. For example, you would like to do an observation study in a healthcare facility, who among the nurses are frequently doing hand hygiene, or you would like to do an ethnographic research wherein you would like to observe or see the usual ways or norms of those people living in an urban area. While when we say laboratory type of research, it is done or performed in the laboratories wherein there is controlled environment. As we have mentioned earlier, there are two major classification of research according to measurement. It could be a quantitative research or a qualitative research. We have discussed earlier many of the types of the quantitative research. At this point, we are to discuss the different types of qualitative nursing research designs. First would be phenomenology. When we do say phenomenology, it intends to gain more understanding or deeper understanding of the lived experiences of individuals, nurses, patients, or anyone in the community. For example, one of my previous researchers, or one I am co-author with, is that we have studied the life experience of those caregivers or family members who are taking care of their of the members of the family who is having type 2 diabetes mellitus. The title of the study is uh, Stay Alive, Be Happy, the lived experiences of caregivers taking care of patients with type 2 diabetes mellitus. Second of the qualitative research design is the grounded theory. This is to understand the social and psychological processes that characterize an event or situation. Usually, grounded theory is utilized when a researcher would like to test a existing theory or create his or her own theory. Ethnography is when you would like to describe and interpret a specific cultural behavior. For example, of the study is that when you do like to explain and understand the healthcare practices, for example, of those people living in a mountainous area. Okay, the researcher in when doing ethnography or ethnographic type of quantitative research studies they do submerge themselves to the specific community or ethnic group where they would like to study their behavior. Next is case study. Yes, case study is an example of a qualitative type of research. So it involves a thorough, in-depth analysis of an individual, a group, or an institution, or their social units. So meaning you could have one uh, respondent or participant in doing a case study. This may be similar to the case study that we or you as nursing students perform or conduct when you do have your clinical area duties. And lastly would be feminist. So from the word itself, feminist, you may be deriving to the term feminine or more of to the female. More than that, it seeks to understand how gender, not only the female gender, and gendered social order shape women's lives and their consciousness. This figure would represent to us the pyramid of evidence. So many type of researches may fall into different levels of evidences. When it is categorized to level 1 up to level 7. Okay? When the research is classified as level 1 research, it could mean that the level of evidence is high compared to those of the lower levels of evidences which may be found onto the bottom or the base of the pyramid. So looking at this pyramid, the bottom or the base of the pyramid represents those researches that may be having a low level of evidence. And when you see types of researches, such as those level 1, could be having as or are having higher level of research evidence. So level 1 may include systematic reviews of randomized controlled trials and systematic review of either maybe non-randomized controlled trials. Usually you can see a double-blinded randomized uh, controlled trials. In level 2, a single RCT or randomized controlled trials may be fall in here and a single non-randomized trial. The third level would be a systematic review of correlational and observational studies. Level 4 could be single correlational observational, systematic review of descriptive and qualitative physiologic studies may fall into level 5 of research evidence, and a single descriptive qualitative physiologic study may fall into level 6. And those of opinions of authorities, of experts, or expert committees may fall into the last level of evidence. The next that you will be seeing is another representation of what I have talked earlier. So we can see here at the bottom of the figure that is found onto the lower side of the first pyramid onto the left is program evaluation data. This may include the feedback of experts on to their specific topic. Next to it is quality improvement information, expert consensus, or the agreement of those experts in a specific field, for example, in the field of diabetes and care. Descriptive studies may fall into the higher level of evidence. Non-experimental studies and quasi-experimental studies may have higher levels of evidence compared to those of a descriptive type of research. Cross-sectional surveys and case reports, cohort studies and controlled studies, and of course, randomized controlled trials are found at the peak of the pyramid. So same as with this, another uh, levels of evidence. Started at the bottom, the editorials, expert opinions, going up of the pyramid to the systematic reviews. So we learned that systematic review is the highest form of research evidence, and those of the lowest form of research evidences are those of the uh, opinions coming from our experts and those of program evaluation information.